All right, so we talk about the TAPP, that's a TAAP, all right, and it's fully known as the word Transabdominal Peritoneal procedure for inguinal hernia repair. Okay, so this actually confuses some students a lot. Okay, and the differences is just here. For the TAAP, you are going through the peritoneum to repair the hernia. Okay, then for the TEP, the peritoneum is down while you repair the hernia from up. Do you understand the difference now? Okay, so let's talk about this transabdominal peritoneal procedure for inguinal hernia. Yeah, we'll look at the steps involved in this procedure. We look at the advantages, we look at the indications, when you should do it, look at the contraindications, we look at the surgeon requirements, we look at the patient's benefit from this repair. Okay, so we said that the transabdominal peritoneal procedure for inguinal hernia is actually a laparoscopic surgical technique used to repair inguinal hernias, right? So the steps involved include, before you can actually put your laparoscope down here, you have to make some small incisions. So small incisions, about 2 to 3, are made in the abdomen. Then you insert the laparoscope. So that a laparoscope is inserted through one of the incisions. Dissection. The peritoneum is dissected to access the hernia. Do you understand? That's just the major difference. You are going through the peritoneum to access the hernia. Alright. Then hernia reduction. The hernia is reduced and the sac is dissected. Mesh placement. A mesh could be placed over the weakened area. Okay. Then you fix the mesh with sutures or tacks. Alright. Then closure. After you've done everything, you close the incisions that were made to actually inside the laparoscope. A very simple method, right? Very, very simple. This one, you are going through the peritoneum, while the TEP method, you push the peritoneum down. Don't pierce the peritoneum. One thing is, this one you are piercing the peritoneum, it could lead to peritonitis. Okay, so talking about the advantage, it is a minimal invasive method. You are not really cutting the patient too much. You just need all those small incisions to insert the laparoscope. Okay, there is actually a less post-operative pain. That's after the operation, all those pain complications is less, right? There's a faster recovery time, there's a reduced risk of complications, and there's improved cosmesis. That's like how the skin looks before the surgery, how the skin is looking after the surgery. It could be the same, or there could just be some slight changes, right? So instead of leaving all those big scars for everybody to know that you had an operation, this one is less of that. Indications now, that's like when to use. If you have a unilateral, bilateral inguinal hernia, you use this method. If you have a recurrent inguinal hernia, you use this method. If the patient had a previous abdominal surgery, you use this method. Then contraindications, when you shouldn't use this. If there's a large or complex hernia, if there's a post-surgery candidate, okay, if the patient has obesity or ascites, they don't want to actually go piercing the peritoneum. Do you understand? All right. So talking about the surgeon requirements, the surgeon should have advanced laparoscopic skills. That they should also have an experience with this transabdominal peritoneal procedure. Then they should also be familiar with hernia anatomy and mesh placement, so that you don't go do something and 2 months later the patient is coming back for complications. All right. Then patient benefits. One thing is, it's just a minimal invasive surgery. So there's quick return to normal activities, there's less discomfort and pain, and there's reduced risks of complications. All right, there's improved cosmesis. All right, so that's it about the transabdominal peritoneal procedure for inguinal hernia repair. See you guys pretty soon.